All right, good morning, good afternoon, or good evening, depending on where you are calling from. Welcome to what is a Family Justice Center. My name is Gail Strack. I'm the CEO of Alliance for Hope International. If you are seeing this slide, you know that this is our instructions for our webinar. We've got a lot going on today. We've got 200 attendees, so that's always fun and exciting to know how many people are interested in this topic. So I'm going to walk you through various things, but if you have any problem at all, just reach out to us and we will start doing some problem solving. I'm going to go ahead and control the slides, and hopefully you're at the right webinar at the right time. I tell that to my law students every now and then to make sure they're in the right class at the right time. But today we get to present everything that we learned about what is a Family Justice Center over the last 30 years in about 30 minutes. No, I'm just kidding. But today, joining me is Natalia Aguirre. So before we go any further, I'm going to ask Natalia to say hello so you can put the name, the face, and the voice all together.
Thank you, Gail. Well, what a pleasure to present with you. And as Gail said, good morning or afternoon or evening to all of you who are joining. My name is Natalia Aguirre. I'm the National Director of the Family Justice Center Alliance. And again, I'm really excited to be presenting today with Gail.
So Natalia, before we go deep into what is a Family Justice Center, will you say a little bit more of some of the things that you're responsible for? Because you are the future.
Oh man, we are so busy. Your Family Justice Center Alliance team works on multiple projects regarding and surrounding family justice centers around the country. So not only do we manage our Office on Violence Against Women Technical Assistance Grant, which manages this call, has sponsored this today, and along with our monthly directors call, and we also put on the conference, our annual conference, our 2 leadership summits a year, one of which is coming up in September. So September 24 to 26, I'll be sending some information on the chat feature about that. We also have our OVC Poly-Victimization Initiative, which, as all of you may know, is a really groundbreaking and transformational initiative at 6 family justice centers across the country. We are also working with OVC on a new technology initiative, which we're very excited about. It has just begun, and we are going to be creating a centralized intake case management system for family justice centers on Salesforce. So stay tuned, really exciting developments on that. And then we also work with OVW on our substance use grant. And so we are working with 3 pilot family justice centers on rolling out substance use services and working with substance use service providers around communities. And then, of course, we also have our consulting work. So working with family justice centers around strategic planning, evaluation, and study tours. So Gail, we're busy.
We are, and thank you for that. That was perfect because I think it gives you a little overview of where we are today. So in this webinar, we're going to go back in time and then we're going to fast forward to go a little more detail. Also, in putting this PowerPoint together, we realized that we probably have too much information in one PowerPoint. So we have a secret slide in the middle of this PowerPoint to kind of just check in with you. Also, we have a secret weapon, which is Natalia. So Natalia is right now going to be monitoring the chat feature, which allows you to start asking your questions now. She will essentially be facilitating as I'm talking, also identifying some resources based on your questions and some other materials that you might be interested in. If we do find that we need to break this up into 2 parts, part 1 will be what is a Family Justice Center today, as we've started and we're evolving. And then part 2 will be how do you actually get started? So as you can see from this slide, this webinar is being recorded. I think it's going to be a good updated webinar for you to be able to utilize in your community as you are presenting this information and getting buy-in about family justice centers. As Natalia mentioned, we owe a great deal of gratitude and thanks to the Office on Violence Against Women. And if you haven't heard, we have a new acting director. Her name is Laura Rogers. She is a former prosecutor handling domestic violence and sexual assault cases from San Diego. So we're very excited that she is now in this position and leading the way. You also will see a picture of Kevin Sweeney, who is our amazing program manager. We're very thankful that that he is part of this initiative and really guiding the way and helping us. We always like to give a shout out to our staff, and now we have two special people who have joined our team, Dr. Chan Hellman, who's our lead researcher, and Dr. Bill Smock, who is our medical director, and he is helping us think through what does medical services, family forensic medical units look like. He's helping us in our work of strangulation, long-term consequences, imaging. He's just like really cool because he's like a cop and a doc all at the same time. So we're lucky to have him as part of our team, as well as Chan Hellman. Behind the scenes today, we have Riley and Bren. They're the ones that are doing all the worrying about the technology, so I can just have a good time and share what we have learned about family justice centers. In answering that, I thought of doing it in two ways. One, I wanted to tell you what is a family justice center by a legal definition, because as many of you know, I'm a former prosecutor, former defense attorney, and I also spent 1 year in county council, and I've dedicated my entire career really to this issue about early intervention and protecting victims from further violence. So hopefully we can prevent any homicide from happening. But what we have in California with we have about 20 family justice centers in California. About 5 years ago, I think, we ended up passing legislation that really defined what is a family justice center. We have 2 other states that have passed family justice center legislation as well. And as you can see here, it is multi-agency, multidisciplinary centers where public-private partnerships essentially come together to try to address as many issues as possible, because victims are poly-victims. They are dealing with more than one issue, from domestic violence, sexual assault, elder abuse, human trafficking. And the idea is just to provide as many of those services from one location to reduce the number of times a victim has to tell her story and reduce the number of times a victim has to go from place to place. As you all know in this call, we lose them in that process. So what we're trying to do is not duplicate any services whatsoever. It's to take the best that you have in your community from those private-public partnerships and co-locate them in one place. I really like this photograph of Suzanne Schultz. I think she is a gifted FJC director, but I think she's also a very gifted stand-up comedian. And when I had a chance to go to her study tour and her informational meeting, she did something that was very clever. Number one, she really described the best of every piece of technology we've ever had and where we're trying to go, essentially with the Family Justice Center, much like a smartphone that now has your calendar, your contacts, your photographs, your music, all in one location. So it was really cool. The other thing she did is made me have an out-of-body experience when she had her informational meeting, because she made it difficult for people to come into the conference, into the meeting, because they had to wait in this one long line with only one person to take their information. And then at lunchtime, she scattered the food all over the building. The lunch, actually sandwiches was in one location, the beverages in another location, the chips were in another location, the cookies were absolutely in another room, the utensils and napkins in another room. And at first I didn't understand what she was doing, but then I got it, because it was very frustrating to everybody to go all these different places to get their meal for lunch, given that they had a short period of time. So it was very clever. And I thought that was a great way to also summarize what is a family justice center. To find out who's on our call, we have only one poll question for you. And Riley is going to administer this so it goes smoothly. And what we're trying to find out is, are you just getting started? Is this a twinkle in your eye or eyes? Is this are you in a development stage where you already have a planning team together? You brought your champion and your best friends to be able to think this through, or are you getting ready to open up within the next 12 months? This will also help Natalia as she is managing behind the scenes in the chat room. So we'll say go. I'm not seeing, we're going to see if it's working. I do not see any numbers. This usually happens very quickly. Okay, I say abort mission. Okay, so we're going to keep on going. What is a family justice center? And what I wanted to do is kind of like start from the beginning, because I think for any center to open up, there needs to be that historical background, that history of relationships, that history of working together, thinking this through, being best friends, coming up with policies and protocols and specialization. So the vision for the San Diego Family Justice Center really started in 1989. That's why I said it's been 30 years in the works. And when we started to do this work, you're going to laugh, but back then, that's our team, Casey Gwynn, who has been our leader, our visionary, our champion, our go make it happen person. And we started back in 1989 with the vision of starting a family justice center, because we had learned how to prosecute cases with or without the victim's participation. We got really good at that in order to give victims the option of whether to testify or not. But in that process, it also led us to where we are today. And how that happened, for me in particular, was I was handling this elder abuse domestic violence case, and it had been on the tails of probably handling hundreds of these cases. And it was at this point that I changed my direction, because Ethel at that time, after we got a conviction, she was uncooperative, didn't want to testify, but she also wanted the violence to stop. At the end of it, when her husband had been convicted, she turned around and said, well, now what? Now what do I do? Where do I go? Where do I live? How do I get my Social Security? And the list went on. And it hit me, because many victims were asking the same thing. So early on, our solution to the issue of now what, where do I go, how do I get help, even after holding people accountable, was a brochure. I laugh about this all the time. That's to show you how naive we were. But I thought, if we can only put a brochure together, it will make this whole process easier. And in that journey of just trying to put a brochure together, it took us over 6 weeks, because what I didn't realize is that San Diego was rich in programs and services, but the challenge was that it was all over the community. As you can see, as these programs and organizations are popping up, they were awesome, and what they were providing was amazing. But as we started to kind of break down and figure out what were all the steps, we realized that whether it's the criminal justice system or the medical system, most of our systems are very daunting and difficult to navigate. Then we started to do focus groups, asking victims what did they want, what did they think of the system, and it's no surprise that they did not want to go to the courtroom. That was the scariest place. They also said that this place is hard to navigate. Your brochure is great, but we really need you to be the brochure. The shelter was the safest place to go, and we don't want to tell our story over and over again. Much what we had already started to learn with the child advocacy centers and their movement and what they were trying to do with children not having to tell their story. We also realized that we were paying for a lack of collaboration, because we decided to try to figure out the cost of one murder. If we could prevent one murder, we thought that that would be some measure of success. Obviously, we wanted to get to zero, just like everyone that's on this call. But as you can see here, our early estimate of one domestic violence homicide was 2.5 million. Back in 2010, a report came out from this Iowa State University that found that the cost of a murder was actually much higher. What was interesting to me is that they were able to calculate the cost of one rape, the cost of one aggravated assault, which are probably most of our domestic violence cases that end up being charged as felonies, but may be reduced to a misdemeanor. And we also realized that it was an opportunity for us, as a result of the wonderful work that had been done by the child abuse movement, women's movement, sexual assault, and domestic violence. All that effort brought us to where we were at that time and where we are today. Collaboration all across the United States in all of these areas had made a difference. But for us, starting with our vision in 1989 and what I see now as we continue to work across the United States and around the world, helping communities open up their center, is sometimes you have to wait until the stars align, and then you have to move fast. Our journey from the idea to co-location, as you can see here, was a long one. And when we first proposed the idea, Casey Gwinn went to our district attorney, our elected officials, our key stakeholders, and presented the idea. But obviously it was an idea that its time had not come. We were not ready for it. It's kind of like what we also joke, if people see your dreams, then it can be a vision. If people don't see it, then it's a hallucination. And so at that time, it wasn't a hallucination for most of San Diego. But we started to collate that very next week. We decided to co-locate one partner at a time. And I think that's where Dream Big, Start Small actually started. We didn't get to have our dream immediately, but we started to co-locate advocates, a civil legal attorney, an advocate from Children's Hospital, the police department, and with a small core team, we realized that working together was very powerful and it could work. But it did take a lot of time to finally open up our Family Justice Center, as you can see from that journey. And I share that with you because part of getting ready to open up a Family Justice Center is documenting your journey. All the individuals and organizations that have already done a tremendous amount of work to get to where you are today, to even have your discussion about, are you ready for a Family Justice Center? Do you need one? And who should be on site and who should be off site? For us, it was interesting because we were still struggling with turf issues. I'm just going to say it the way it is. And so what we decided to focus on first was domestic violence cases only, because at that time, the sexual assault community and the child abuse community and the elder abuse community just did not want to move in together at that time. But what was also interesting within that first week of opening up, guess what? Victims came with their children, and we were dealing with child abuse. We had elder abuse victims and sexual assault victims, and everyone quickly saw the need to have all of those partners on site. So finally in 2002, we were able to open up. I always like to show this picture because this is a photograph of Casey Gwinn, our mayor, our police chief, our elected officials. And it was at one time in history where they all agreed on the same thing at the same time, and that was to open up a Family Justice Center. And it also said something very significant to families who were hurting at that time, is that this is no longer going to be a special project or a vision of the city attorney's office, but this is going to be a center that belongs to the community, and we are here for you for the long run. And that was an important message to send. So how it started is sometimes you do have to start small. Having a partnership between the police chief and the city attorney's office was key. We decided that that was going to be a public safety initiative for the city of San Diego, working closely with all of our nonprofits to provide the services that the victims needed. Our goal was to become that place, that one place where families came first and professionals would come together. We created a big vision, and this is another key piece in the journey, is what is it that you see for your community? This was our vision for a Family Justice Center, which we still utilize today. So I think it definitely was a vision for the future if it still works 30 years later. So the idea was really simple, is to try to get as many partners together under one roof. At the time that we opened up at the San Diego Family Justice Center, we had 20 to 25 partners within that first year. I would say that first month as people were moving in, we had about 20, and then soon we started to fill up and had to go back to City Council for another floor. So as you can see here, we wanted to move all of those services that were scattered all over San Diego to one location. Then we really focused together as a team, what do we want to do once we open up? And our overall goal was to make victims safer. We wanted to do it by, first, providing consolidated services. Two, because police and prosecutors were also on site, accountability. Because we listened to all of our survivors and our partners, we wanted to make it friendly and a family-centered facility. And we wanted to really focus on early intervention and prevention programs. and continue to make new friends and to coordinate in the community, within the state, and across the United States. So as you go forward, I'm going to ask you this question. How many brochures do you have? I always laugh at this brochure because we were in New Hampshire getting ready to think about how we put together a strategic plan for New Hampshire. We started off with our study tour. We were doing our site visits to a local shelter, the courthouse, the prosecutor's office, and right down the list. And all of a sudden, I was asked the question, who do you think should be invited? And I laughed because as I looked up on the wall, what I saw was the most beautiful brochure rack I've ever seen in my whole life. And all of those brochures really represented all the individuals and organizations that needed to be invited. So what we thought we would do today is kind of walk you through when we opened up the San Diego Family Justice Center. This will give you an idea of what is a Family Justice Center by seeing it. I happen to be one of those visual individuals that you need to kind of like see it to try to understand it. So when we opened up, our goal was to find a central location that was going to be convenient for victims. We wanted to make sure we had sufficient parking for everybody that was going to be on site, as well as the future survivors and clients who would come visit us. Court was key, public transportation was key, and trying to be cost efficient was key as well. So let's go ahead and take that tour to find out who's on site, what did they do, what responsibilities, and what was their role, and overall what services they provided. Our Family Justice Center at the time had 4 floors. We had about 25 partners when we were fully operational, and we had about 120 professionals there at any given time with another 100 plus volunteers. So this was the second floor. The second floor was the community floor, and it was the floor that victims would enter. And we would have one central location. It was designed to be warm and welcoming. Our focus groups, our survivors said they wanted to have something that looked like a home, that was relaxing. So we worked really hard to get that picket fence and that roof. We tried to accommodate folks with appointments and without appointments, try to answer their calls. We had our whole informational line. We had volunteers answering the calls. We would also address any kind of discovery with our police and prosecutors being on site. We also had a lot of site visitors who would come in. Sometimes I think they were survivors who just wanted to see what the place was like, especially during our open house, and confidentiality was the key. Here was our dining room where we were trying to make it warm and welcoming. It was a place, as many of us all know, you can have a beautiful home with a formal living room, but everybody hangs out in the kitchen and where all the food is. We also created a private telephone booth so people can make phone calls, and a private quiet room in case you were in crisis at that moment and just needed to be by yourself. We created a huge kids waiting room along with living rooms and dens to really make some private interviews and make it very comfortable. These were designed by our domestic violence and sexual assault advocates. And then of course, I just want to add that even as we were moving in, we were addressing work culture, because as the police department moved in, as you can see in the before, they had furniture that they were used to interviewing victims. I call it early garage sale furniture that government would receive. Usually the furniture did not match, but there was a table in between. And then of course, it was after we moved into the Family Justice Center and what that interview room looked like. So that was a big change for us, just going from the old way of doing business to a much different approach, which was trauma informed. We didn't call it back then trauma informed, but definitely it was just to be kind and comfortable. And then of course, the intake process, we created a technology system that would help us keep track of when clients would come in, how long they were waiting, so we can go out and advise them of when they would have a chance to meet with one of the partners, and if we needed to move things around, we would. We would also go through the consent procedure, informed consent, explain our services and partners that were on site. The goal was to provide the services right there and then and not make any referrals from the Family Justice Center to an outside agency, because that defeats the whole purpose. The other big goal was to have as many partners on site at that time, so we didn't have to tell someone that you'll have to come back on a Tuesday at 2 o'clock when that partner is here. We had some amazing advocates and intake workers who were able to do all of the things that we decided we needed to do to find out what brings victims in, what do they need, go through a risk assessment, go through safety planning, and then go through a plan for the services that they have requested. So now I want to go through one of the top things that they needed was a restraining order. So Center for Community Solutions was one of our on-site partners back in 1990, and they were also one of our very first on-site partners when we opened up the Family Justice Center doors. We had a chaplains program because people in crisis need spiritual support, and children who witnessed domestic violence needed help from Children's Hospital, and we had an amazing team and staff there to address children exposed to various violence. We had our San Diego Domestic Violence Council, which this was their #1 goal, to open up our Family Justice Center. We also had a forensic medical unit, which was led by Dr. George McLean. We had a team of medical folks there, from Dr. George McLean to forensic nurses and volunteer nurses. We created not one, but 2 forensic exam rooms to accommodate sexual assault, child abuse cases, and domestic violence cases. The rooms were decorated by staff, partners, so everybody really contributed to all the little details of opening up a Family Justice Center. The goal with that was to create ownership, that everybody would help and come up with ideas and have their fingerprints all over our centers. We were also ADA compliant by having a shower on site. We ended up having on-site counseling to be able to address the counseling immediately. Our goal was to provide counseling within 72 hours or less when either an adult victim or a child victim had been exposed to trauma. We had San Diego Deaf Mental Health Services. We also had our second legal program, and they were really focused on providing court representation from the San Diego Volunteers Lawyers Program, and they provided services for child custody, anything that was related to in-court long-term representation. We had traveler's aid on site that sometimes we found that the best safety plan is to leave San Diego and go either back home or go to a place that the victim identified was a safe place for her to be. We also had the district attorney's office on site with an elder abuse task force and program. We had Union of Pan-Asian Communities that would do some outreach and provide interpretation and translation services in many different languages. Within, I'd say, 3 months, we were in desperate need because build it and they will come. We went from 87 clients our very first month. Within 3 months, we're already at 300. And ultimately, when I left as the director, we were up to 1,200 clients per month with 3,000 phone calls coming in with individuals asking about questions. We were able to get a volunteer program administrator to work full time and ultimately building a program of 100 to 120 volunteers. And it was thanks to Sergeant Robert Keach, who really thought that through in the San Diego Police Department, who already had a great program with 800 volunteers strong. So we went to them, borrowed all of their ideas. We also assessed with all the community partners who had volunteers as well and created a program. Our program was really to set the highest standards, the highest expectations. And even though we thought people would not commit to it, they actually did. The more structure, the higher the expectation, the more supervision and training that you can provide, the longer your volunteers will stay with you. And I would imagine that the people on this call understand that. So we had a whole process for recruitment and screening. We developed a 40-hour volunteer academy that everybody would commit to in advance, along with a background check to make sure that the right people were in the right place at the right time. And then the volunteers would essentially help us with just about every single function that we had, whether it was intake, hospitality, special events, follow-up phone calls, you name it, they were there. And it really did extend our life expectancy and excitement and energy for the work that we already were passionate. On the 7th floor, we had our administrative floor, and that's where our Family Justice Center team worked. I get a lot of questions about how many people do you need to help coordinate services and the partners at a Family Justice Center. So I'll walk you through that. I was assigned by Casey Gwynn to be the first director of the San Diego Family Justice Center. And I was also assigned to continue my responsibility as an assistant city attorney working on, and I would say if anybody offers you a job that includes the word special project, I would say run. Run as fast as you can, because you never know what the idea is going to be. But I didn't, and it turned out to be one of the best things I've ever done in my life. And I think that's mainly living and breathing a family justice center has made me extremely passionate, because I saw it live and I saw it work, and I saw it work not only for survivors, but also the partners who were on site. We had an administrative assistant who would help us with all of these activities. We had a grant analyst that would help write grants, monitor the grants, develop a budget, lease management, contracts, and also work with all the on-site partners to identify their needs as well. We tried to identify as many grants that we could apply together. We created a shared sustained funding policy so we wouldn't compete with each other. We developed a new San Diego Family Justice Center Foundation to do a lot of the fundraising. We also had human trafficking on site back then in 2002, which was amazing partnership because, as many of you know, some of our domestic violence victims are truly involved in human trafficking, and they're not going to tell you, so you have to get additional training and look for the clues. We brought in Crime Victims Fund, which was a nonprofit organization to help victims in case of emergency, so they didn't have to wait until the Crime Victims Fund would kick in. We had the President's Family Justice Center Initiative staff on site, and as many of you know, we were ultimately asked by the OVW to assist them with launching the President's Family Justice Center Initiative, and we were able to open up 15 more centers all in 2 years. Casey Gwynn's vision was always to address children exposed to domestic violence, and Camp Hope, along with the Family Justice Center, opened up at the same time. We had teen court on site. That was our early intervention program, and within 1 month of opening up, we realized that we needed survivors to continue to guide us and help us educate the public, educate the on-site partners. It was not designed to be a support group, but really to give back to the community by educating and bringing awareness. We had one of the largest training rooms we could put together in this high-rise building. And then on the 6th floor, we had the law enforcement government floor, and there the police department, Police Chief Bejarano, and then ultimately Chief Lansdowne put their entire domestic violence unit at the time, 25 strong. They dedicated Sergeant Robert Keats. The police, they are gifted when it comes to taking chaos and creating law and order. So he was there to help us with day-to-day operations. It started off as a pilot, a 1-year assignment, and ultimately he was there until most recently when there was some change in leadership, and I'll talk about that in a minute. We had the elder abuse investigations because we quickly saw elders were coming to the Family Justice Center and needed that same comfortable environment just like any other victim. We had probation department on site to look at those repeat offenders and develop a team. We had the military. We're close to a number of military bases here in San Diego. And our 5th floor, the city attorney's office dedicated their entire child abuse and domestic violence unit to the Family Justice Center. And I think this is what made the San Diego Family Justice Center unique, by having the entire domestic violence unit from the police department and the prosecutor's office working side by side with all the nonprofit agencies. The district attorney's office brought in a number of their prosecutors. They brought in their advocates to really help with all aspects of either screening or through the process of a court case. And to help heal, we brought in 1 in 3 art project. Local artists were all in to try to create some beautiful artwork throughout. And then we realized we ran out of room in a very short period of time. So I think I'm hoping you're getting the sense of what is a Family Justice Center by identifying all of your government agencies and identifying all of your nonprofits to be on site. So you can also go in phases, dream big, start small, and phase 1 could include 3 or 5 different partners to start working together. One of our crucial offsite partners was the fire department. As many of you know, the fire department is responding to these calls. They ran our paramedic system, and then ultimately we had partnership agreements with 20 amazing offsite partners, and they would be on call. We had a partnership agreement to how we're going to work together, how we're going to share information, how we're going to share information and direct clients to the Family Justice Center, and when they needed to go offsite, how we can get them there in a fast track. And then, of course, something happened. Oprah Winfrey endorsed and featured the San Diego Family Justice Center. I always laugh. That was back in 2003. And my suspicion is President Bush, just like everybody else, when Oprah speaks, people listen. And when Oprah has a show, we all watch. And I'm convinced that President Bush watched Oprah talking about the San Diego Family Justice Center and then stole her idea and then started the President's Initiative. So we were co-located for a number of years, as you can see here, at that high-rise building, and ultimately the Family Justice Center did move to a different location, a permanent location. This was always intended to be temporary. At our high, we were at 1,200 clients per month, and within 5 short years, we started to see our homicide rate dropped by a total of 90%, but each and every year it started to go down. And not one client during that period of time who walked in the doors ever was a victim of a homicide. So we also discovered that one of the biggest challenges about providing services to victims is just letting them know that you exist. And the movement continues to move, and our team just recently went to Ireland to see what is happening there in Derry and the great work that Marie Brown is doing with her team. They're getting ready to open up their Family Justice Center, although I think they really already have a Family Justice Center in the works. It's just beautiful. So I'll quickly walk you through what we are learning from the International Family Justice Center movement, because not one community, one state, or one country has it all figured out, but we can continue to learn from each other. One of the very first Family Justice Centers outside of the United States that opened up was in Croydon, England. It was a government-led Family Justice Center. Then we had a nonprofit-led Family Justice Center in Waterloo, Kitchener, Canada. And of course, in Canada now, we have a number of Family Justice Centers throughout Canada that are opening up. Probably one that's very near and dear to my heart was working in Amman, Jordan, where they opened up 2 Family Justice Centers. One was an extension of their existing Child Advocacy Center, and then the other Family Justice Center that opened up was at their local shelter. Then the next one that opened up was Project Karen in Sweden, which is absolutely turned out to be one of the most beautiful Family Justice Centers I ever seen, and really raised the bar. The other one that I think is very special to a lot of us is the Mexico model. There they opened up, I think they're now at 20 Family Justice Centers in Mexico. It's called Centro de Justicias para las Mujeres. They really wanted to focus on women who were victims of domestic violence, even though they too have men who are victims as well. And speaking about men, I get this question quite often too. Do men go to Family Justice Centers? And the answer is yes, depending on which Family Justice Center. We see anywhere between 10 to 15% of men seeking services at Family Justice Centers. So that's something that has to be discussed as part of your planning process. And most recently, we now have the European Family Justice Center Alliance, where we have close to 20 Family Justice Centers spread out in Europe that have started that co-location model. The FJC in Antwerp was one of the first ones. So you got Pascal Frank and Davy, who ended up putting together their book on how to start a Family Justice Center. And as I mentioned before, Northern Ireland, they are off and running. Not only do they have an amazing campus model right now, they are getting ready to open up their second location, located right in the heart of Derry, very close to the courthouse, very close to transportation. And they were able to already raise their funds to be able to open up. And this center will have housing, will have transportation assistance. I mean, the list goes on, and it was very inspirational for us to be there And I came back all fired up with some of the ideas that Marie Brown and her team have come up that we can certainly incorporate into ours. So what I wanted to do now is kind of walk you through how some of those ideas early on have evolved from the San Diego front porch lobby to take a look at what Fort Worth is doing. Now, this is a lobby. I have to tell you, I love our friends in Texas. When they first came to us and said, we need your help in starting our Family Justice Center, no need to reinvent the wheel. They said, Gail, Casey, we're not the first Family Justice Center, but we plan to be the biggest and the best. And kudos to them for dreaming big. And I would say since they opened up their Family Justice Center, the dreams are definitely getting much bigger and setting a high bar for others to follow. At One Safe Place, not only do they have an amazing lobby, but they have a whole program for children and childcare. They have a big, not a cafeteria, but a big area for lunch space for staff, open space for people to walk, talk, and work. And if you look at the picture on the left with Casey and me standing behind their reception area, that bulletproof window is gone. So it gives you a very open feeling. And then, of course, came a nonprofit-led Family Justice Center in Milwaukee, led by Carmen Petrie. And so what they have done there is just amazing, a campus model where they also have shelter on site. The Family Justice Center in Fort Worth, Texas was approximately 68,000 square feet. And when Carmen opened up her Family Peace Center, they were at 72,000 square feet. And I'm told that rumor has it that after hearing that, our friends in Fort Worth, Texas made an announcement that they have an expansion in the works. So they're going to beat the 72,000 square foot model in Milwaukee. And I think that's good. I think it's really great that we're at the point now where we're competing to be the best Family Justice Center, to provide the best services and create the best environment for victims to receive those services and heal. As you can see here, just some photographs from their reception area, workspace, forensic medical unit, children's room. And then, of course, now we have Nashville Family Safety Center, the center that has opened up most recently and is also one of the largest family justice centers in America. I haven't had a chance to tour it myself, but I look forward to it. We've got also a lot of work that is happening in Oklahoma City, where they have in the works a planning process to have a family justice center with over 100,000 square feet or foot campus. As you can see here, there are the renderings of what it's going to look like, and it just looks absolutely beautiful. Tulsa Safety Center is working on theirs. Theirs is also going to be over 100,000 square feet, and what they're doing is making room for all the partners that traditionally were off-site partners because of lack of space that can now be on-site partners. And not to be outdone by anyone else, San Diego has gone back to the drawing board, and we call it bringing the band back together again and thinking through what does our future look like. As you can see, amazing work has been done across the United States and around the world. I would say a new partner that has been added to many of our family justice centers is the solo practitioners, or called the Justice Legal Network, where attorneys that have just passed the bar and they're trying to figure out their future are co-locating with family justice centers to provide civil legal services, to provide representation, because sometimes victims will be and will see themselves as a defendant. So what does that look like? And we have seen competition with the children's room. Our old children's room, oh my gosh, it's embarrassing now compared to what the Anaheim Family Justice Center did. They were adopted by Disneyland, and their goal was to make it a place where everybody wanted to go and even have their birthday parties there. And as you can see, they accomplished that. We're also seeing services expand across the United States from Alameda to New Orleans, and they're having more learning centers to really create that community for victims. So family justice centers are not just in the crisis, but we're going to be there for the long term. We're seeing family justice centers Most recent one in Guilford County Family Justice Center that has video streaming right to the court so victims can get their restraining orders from their Family Justice Center without having to go to court. The dream in Fort Worth, Texas is for the judge to go to their Family Justice Center and provide restraining orders there, which is very similar to the Mexico model. The Mexico model, they do have courtrooms, and if a batterer gets in there, they actually have a jailhouse as well. They have shelters, so if, like, for example, one Family Justice Center in Mexico, if you come in one door, essentially that's where the individuals who are charged with domestic violence will come. If they need to be incarcerated right away, they will. On another sort of street, the victims will come in, and they even have shelters on site, and they have the forensic medical unit on site. They have a school on site. It's really quite amazing, and I think has really inspired us to keep going. The interview rooms are just getting better with technology. They're including family rooms now to allow families to be with their daughter, with their mother, with their grandmother, to be able to provide that support. I love what Montgomery County did. They have, I think, approximately 11 interview rooms, which allows victims to pick the room that they want to go to depending on their mood that day. And I wanted to come back to the open floor plan that you'll see at the Fort Worth Family Justice Center, One Safe Place. It's pretty exciting, and it really inspires a lot of team collaboration and teamwork. Large conference rooms, they are even getting bigger. Fort Worth, Texas is probably one of the biggest one. Milwaukee has a dual one where you can work with the kitchen, so you can have a lot of events there. Dress for Success has traditionally been an offsite partner. We're seeing at many family justice centers now. We went back to Project Karen to try to steal some of their ideas. So we definitely have challenged our family justice centers to go with the best furniture, the best appliances, to have one of the best kitchens available so the victims can feel comfortable. We've done a lot of research and evaluation since the early years. If you go to our website, you will find a long list of either projects that were done by PhD students for their dissertation to published research. Probably the biggest one that we have now is from 2017, which has validated the work that's being done at family justice centers as a best practice. Take a look at it. I think we have at least 15 different reports that's listed and posted on our website. You also do not need to reinvent the wheel. We have the why and we have the how. Dream Big is about the why, and then Dream Big, Start Small really walks you through every core step that you need to take. And I would say doing this work now, there are the keepers, the do-overs, and what the heck we were thinking. I think if you go to Dream Big, especially the people who are on this call, read every chapter so you do not have to reinvent the wheel. You can almost like leapfrog and come up with a whole set of new questions. But what it does, and what I figured out, is that every chapter, every step is important, and you really cannot do any shortcuts. When you try to shortcut the process, that's where problems do occur. We also have a long list of benefits that are listed in the various reports and research that has been conducted. But what I heard from the partners who were on site, and this is the first one, it's going to save a lot of time. I remember Jackie Dietz from Children's Hospital. She said to me after being there in 1 month, she says, what we are able to accomplish in one day would take us 2 weeks in the past, because we would have to drive victims from place to place. They were able to stop hiring as many drivers, and were able to hire more case managers to really support victims on the long term. The other big improvement was our attitudes. As you know, this is hard work, and there is vicarious trauma, but being together and supporting each other really became a very positive reinforcement for each other as we were going through difficult times. And we were stronger and better together by the investigations, the support that we were able to provide, and more victims were able to come along with their children. We were able to reduce the homicides, as I shared before, and in our next PowerPoint, we'll be able to share a little bit more as we're seeing what family justice centers can do. We have a long list of things for the prosecutors or government-led family justice centers. What extended our life expectancy as prosecutors is that we went from like 82 trials before we moved in. And as you know, 82 trials that go. That means you got 400, 500 cases that are set for trial. They got police officers that are being subpoenaed. A lot of work is going into that can quickly burn you out. And then we went to 22 after 1 year of being open. So the cases got better, the victims felt supported, less victims recanted. We also gave a victim an opportunity to seek help at the Family Justice Center as opposed to calling 911 and having police respond. But I will tell you, it's a lot of work. So I would say be ready for that work. And I wanted to share what those challenges are. I would say one of the big ones was, and even though we anticipated this, change of leadership or change of partners was difficult, because as soon as we would get our group, there would be a change. And that is really normal. So anticipating it and expecting it is really a good advice that we can give you. And then there was change in commitment, because we realized that funding would come and go, partners would come and go. So I would say a big learning from that is investing in your partners, investing in each other, and maintaining that strong relationship. We also saw a change in economy can change the impact of your Family Justice Center. What's happening in your community can reflect on what's happening at your center. The other thing that I would say is for the early or the first generation of Family Justice Centers, we were still building and flying, trying to figure it out, but we have learned a lot. And I think one of the learnings was really plan for the future. After you have a robust strategic plan, planning for what does shared sustained funding look like for your center and all the partners in the long run would be key. And then how do you maintain adequate staffing levels and maybe a volunteer program? So this way you can extend everybody's life expectancy and reduce trauma. So here it is. We are going to check in right about now. So Natalia is manning the chat room. Natalia, what do you see? Can you share?
Yeah, we have not had a whole lot of questions come in, but one, Gail, that maybe would be helpful that has come around is around the experience of setting up or starting family justice centers in rural areas. So you shared a lot about big kind of communities and cities that have started really large family justice center, but the questions were, what's the success rate of having family justice centers in rural areas where resources are limited? So what do you think? You want to jump in about that?
Well, you might have the more current numbers, but that's a very good observation. We did show you some of the bigger family justice centers across the United States. They are definitely small, medium, and large. When the President Initiative started, the 15 sites that were selected were from communities that were small, medium, and large. And I would say probably most of the family justice centers in the United States are smaller than they are larger. So Natalia, I don't know if you've got the current numbers of how many are rural.
Yeah, so I would say most of our family justice centers are probably in pretty medium-sized communities. And then we have like a sprinkle on the top in very large kind of metropolitan cities, and then some smaller sprinkling. For those who are interested in looking into that, we do have a webinar on our resource library, which I will send the link in just a second, about the Family Justice Center in Northwestern Ohio. That's a family justice center in a very rural community spread out over many, many, many hundreds of miles that actually has one family justice center and then 6 satellite locations. And they've had a ton of success in obtaining funding and support from their family justice centers, and also have had really wonderful leadership. And so I will make sure to send a link to that for those who are interested. And what we have found, Gail, as you might want to jump into, is that those smaller communities that have had histories of collaboration and coordination actually tend to have an easier time starting a family justice center. And sometimes that is just the feature and the advantage of working in a small community, is that you have less resources and really do have to coordinate and collaborate.
I agree. And I think one of the smaller jurisdictions we worked in was Sweetwater, Wyoming. And just like you described, very spread out, very rural, small population, but a lot of great work came together, because there, they did not even have a child advocacy center, and they would have to drive children who were sexually assaulted or physically assaulted hours to get a forensic exam or a forensic interview. And even if you have less victims, each and every one of those victims needs the partnership that comes with the Family Justice Center. And as a result of just starting their Family Justice Center and thinking about it and planning, they were able to mobilize their community, start that child advocacy center, start that Family Justice Center, provide more counseling for victims, which many times victims had to wait months and months for, came up with some creative ways to do it. And I think that was a reminder to me. Just having that discussion of, do we need one? Can we have one in our small community, medium-sized community, or large one? Really, from place to place, has led to a lot of great things happening within a short period of time, even before you open a center. So I definitely advocate, just ask the question, do we need one? And I have yet to find a community that has said no. It's just kind of figuring out how to get there. Because if you have victims who are going through child abuse, domestic violence, sexual assault, elder abuse, or human trafficking, you need a Family Justice Center, because there's just not enough shelters in America that are available to victims. And most of the shelters, they can only stay there for 30 days, 60 days, maybe 90 days if they're lucky. So we really do need to provide more doors for victims to seek those services, whichever door they come from. So if we have no questions, I'm going to think that we can continue to plow through.
Oh no, the questions came in, Gail. So there's a couple clarifying questions here that I think would be really helpful for folks that I'm sure everybody has at the top of their mind. So of course, funding. So people wanted to know if you could review some of the primary funding streams that the San Diego Family Justice Center used in beginning stages.
Well, that's a very good question, because at the time we had no funding. So the first step was getting our mayor and city council to embrace the idea. So that was step one. And they said, yes, Casey Gwynn and our police chief, David Bejarano, we love that idea. You go for it and you go find the money. Initially, we had a hard time finding those funds because the grants that we filed, the funders could not see what we were describing. So we really had to invite the funders to come meet the partners, hear from Casey and our police chief when they talked about the vision. And once you can get people to see it and understand it and feel it, the better. I think today, Family Justice Centers are in a much better position because you can go visit a Family Justice Center near you, which funders need to see. I think the good news now that we also have is we have a lot of research. We have identified this as a best practice. We know under the theory of collective impact, we can do much more working together. California Endowment was one of our very first funders. So a foundation can embrace you. They gave us initially $500,000 to get started, and it was Casey's idea to challenge the city of San Diego to match that grant. So within a very short period of time, which had a 30-day deadline, we were able to have $1 million to get started. And then from there, we filed grants like everyone else. We identified every funding source known to mankind, whether it was private, public, federal, you name it, or even individual. And then we created the foundation to help us to identify donors and people who would love it. And our goal was to identify new funding sources. We have a whole PowerPoint, essentially, or a whole discussion or chapter on funding and sustainability. The way we approach funding and sustainability now is very different. When we filed one of our very first grants, every grant has this section that says sustainability. How do you plan to sustain your program, your project after this grant is over? And I went, beats me, but I made it up like everybody else. But then you realize that funding and sustainability is a core, and funding and sustainability, but I mean by saying sustainability, it's going to be those partners, it's going to be on-site volunteers, it's going to be community awareness, and I don't have it all in front of me, but we have created a method, a 5-step method of all the things that you have to think about when you think about funding and sustainability. To create a full-blown plan, it really requires going back to what we learned from strategic planning, bringing back all of the key stakeholders related to funding and sustainability that can help you figure that out. We have a new secret weapon that we're going to be able to offer to those of you who are on this call. We were able to recruit Donald Krupp. He is a former county financial administrator from 2 jurisdictions where they had family justice centers. You need to have somebody on your board or somebody that's accessible to you that knows where I used to call where the money is buried. The bones are buried. There is money out there. We just don't know where it is. And it's also trying to get folks to identify your family justice center as a funding priority. So I would say, Natalia, I don't know if we've got a webinar where we did funding and sustainability that we can add to the list of resources.
Absolutely. We can definitely include a couple. We recently had one not on funding sustainability, kind of big scope, but we had one on the Benevon model, which some family justice centers also use for donor development. And so we understand foundations and big grants are a big part of family justice centers, but really a lot of the very successful family justice centers have done a lot of individual donations as well. So we're happy to include that as the resources in the follow-up email as well.
Great. And I don't know, Natalia, if you have in front of you as well, but this might be a good time to share. Well, we've been working on coming up with a new list of new ideas from new funding sources. And so we have everything from what happened in California, where a number of our counties identified funding through marriage certificates, death certificates, vital records, and just increasing those vital record fees by a couple of dollars, where you're not tapping into the money that's already being received for your domestic violence programs. They were able to get a new funding source to cover the cost of operations at a family justice center. So that has been one. We have seen some family justice centers that are coming up with new tax initiatives that might help a local school, a police department that might need a new building, a courthouse, and then really realizing the need for a family justice center to support the families. We have also seen court costs being added to various proceedings at a courthouse. That's something that Tennessee has done that has led to some additional funding for operations. And folks are coming up with creative ways, whether it's small or even large. A small one was in Idaho, for example. They connected with Boise University, and they were able to take a percentage of all the parking fees that they received for special events that went to their family justice center. I thought that was a really cool idea. Big. We are now seeing some states, whether it's North Carolina, who have identified funding specifically for family justice centers. In California, for example, we had one of the rarest years, I think, in known history, where California had actually extra money when they balanced the budget. And one of our champions, who was a mayor in Contra Costa County, who started their family justice center there, then went to the state legislature, really advocated for family justice centers and was able to dedicate $10 million to family justice center. Tim Grayson, he is just our local hero. We absolutely love and adore him, but he received unanimous support, and he received unanimous support because we have already established 20 family justice centers in 20 counties that had already received the support and buy-in from their local elected officials, that when time came to vote for this, they were all in. So it was unanimous. And that's just a list of few off the top of my head. I don't know, Natalia, if you have anything else you want to add to that?
I think you did a really great job, Gail, in summing up some of the most creative funding sources, but just do want to emphasize, because that was a question that also came up, is how do we not get our Family Justice Center partners to perceive the Family Justice Center as a competitor for funds. And so just as Gail mentioned, really identifying what those sacred pots of money are for your partners, and having very intentional and direct conversations about where they get their funding from, so that the Family Justice Center does not go after that and touch that pot of money, but really find new places and new funders or foundations that would be willing to give to a collaborative. And being very intentional about having those dialogues, I think, has been critical. Kind of, Gail, a little bit more also about the San Diego Family Justice Center. Somebody was really impressed with the number of partner agencies that came into the Family Justice Center, but they want to know what the key was to smoothly bringing in all of those different organizations. It seems like there would be different organizations and personalities and organizational culture. And how did you deal with that? And also the perception of overlapping services between these different agencies.
Well, that's a very good question. And we decided as a group we were going to figure that out. So strategic planning was very key. And one of the work groups that we had back then, it continues to be a work group that we utilize today, which is operations and services and partners. So we brought in all of the partners who we anticipated and had already made a commitment of wanting to be co-located at the Family Justice Center. And then what we did is we just sat down together and tried to identify all possible issues that could come up. We pledged to be very honest and open about that. We pledged that we were going to have those icky conversations, but we were going to walk and work through all of the solutions. So by doing that, it really helped us to identify those issues. We created solutions to each one of those possible issues. A solution was an operations manual, and then also an agreement that before everybody moved in, we would be trained. We started to work on the intake process and the flow of services before we moved in. Now we have a lot more. Today I call them exercises, fire drills, all of the issues that come up when you first move in. Now we know what those are. We didn't know back then. But as we work with those sites, we walk through them. Like, for example, the first fire drill we had was actually a fire drill. And the building had a fire drill and everybody just did what they normally do. We all got out. And then it turns out we left survivors in the waiting room because we did not figure out whose responsibility it was to make sure that all rooms were empty. And then that was a horrible thing that happened. Nothing bad happened, but just the thought of that just like made us all like freak out. So then we started to think of what else could come up. And we started to do drills about that. Another example would be, what if a suspect got into the Family Justice Center looking for his wife or victim, and what are we going to do? Well, one thing that we learned, we brought in the police department and SWAT, and while we were thinking we were going to be kind and creative by changing the rooms from interview room to the living room and dining room, when SWAT came, they go, Gail, we can't figure out where the situation is unless you have like a map and at least you tell us what room number is that living room or that den, or where is that kitchen. So there are a lot of things like that. When it also comes up with confidentiality, we call them, like, usually there's like the top 10 things, and if you think them through, it's going to work. So the partners really helped, and they made a very strong commitment to think with us, plan with us before we moved in. And then we had an on-site committee that was designed specifically to work through those issues in a smaller group, and then bring those solutions to the bigger community. We call it the community partners meeting once a month, and we would adjust the manual, the operations manual, as we went along. We also developed learning from each other, because once you live together, you can bring the best out of each other if you do this well. And we adopted debriefing. Whether it was good or there was a hiccup, we talked every single day like police officers do in a lineup meeting. If any incident occurred, whether we handled it well or we could have handled it better, we debriefed and we figured out better ways to work together. And we also over communicated. We had probably more meetings than anybody could ever possibly think of. We also created monthly meetings to keep our strategic planning alive, which was the blueprint team. And then having Robert Keach create that and walk everybody through all of the operations manuals, the key components before they moved in helped. Having an orientation meeting with new volunteers or new employees helped. When it came to funding, that was a big issue for everyone. I was actually summoned. I call it summoned. They didn't issue a subpoena, but it felt like it, where I was asked to attend a meeting with the local nonprofits association, which included many more nonprofits than I even knew existed than our domestic violence community. And they were nervous and scared about what is this new thing going to do, and will they become a competitor? And so we made a commitment to open up what we were doing, invite people in informational meetings, attend any meeting that we were asked to attend, explain our strategy, and ultimately we created a shared sustained funding policy with our partners that helped with respect to that. And we continue to listen to survivors. So we would ask the survivors, how do we do? What can we do to improve? And they would tell us. And so we incorporated that into our evolution and integration of partners. I would say if you spend as much time as we did talking and thinking and coordinating, it will be a smooth transition, but it requires a lot of work. If you think it's all automatically and magically is going to happen, it's not. But we took the time to do step by step and come up with various scenarios and work through those scenarios before it happened. And if something did happen, we made a commitment to debrief. So I think for me, that's what worked for us. And that was, I would say, teamwork and a history of working together and having strong relationships before we moved in. We liked each other. We wanted to move in together. So that, I think that was one of our keys of success.
Great, thank you, Gail. We have lots more questions. So one more question, maybe specifically about starting a family justice center, and then I have a couple of questions about challenges. So there are a couple of questions about who can start a family justice center, if a new nonprofit who's just getting off the ground is the best person to start a family justice center. Can survivors open family justice centers? What does that look like in communities? And so if you can talk a little bit maybe about that.
Well, you know, that is one part of this. So maybe we can try to fast forward to the section on how to start a family justice center. And I can walk you through those key steps. We can take things out of order. That's the beautiful thing about a smaller group. Sometimes we have like 1,300 people on this call, but this call is a little bit smaller. We are advancing the slides to how to get started because there is some homework and we do discuss how to get started. There you go. Thank you, Riley. All right, good question. Thank you so much for asking that question. We are ready for you. So getting started is all about homework. So the first thing I would say, and I will address who can start it, but if you haven't spent a lot of time, and I mean a lot of time on our website, I would encourage you. The Family Justice Center directors that have done extremely well, they have become students and they end up getting their PhD on a family justice center because some of them proudly say, I've watched every single webinar, I've read every single book and chapter. They attend our monthly meetings, they go to conferences. So the first step is really gathering as much information as you can, especially what's available on our website for free. The next big piece is to see it and feel it, is to bring a team, your Family Justice Center Planning Committee, which is a key to starting, and bring them to our annual conference where you get to meet people from other communities, whether it's small, medium, or large, where you get to meet with other directors in our pre-conference, where you get to go through 2 different tracks of Family Justice Center workshops, those that are just starting and those that have started. We also recommend that you take a team of folks to go visit a Family Justice Center. And if you're in that first category where it's the twinkle in your eye, you can set up an informational phone call where we go deeper into how to get started. This one is a little shorter version. And then, of course, we say the power of we. You can't show this video, but I would definitely watch Lone Nut. It's what every movement requires, because the Lone Nut video, I think we have it in our resource library because we play it everywhere we go. It's a short video on leadership and starting a movement. But what it talks about, oh, there it goes. I don't know if it's really going to play on, but I'm going to just fast forward. Is number 1, you got to recruit your champion. And whoever that might be, it could be your mayor, your city council. So when I say champion, we also mean champions. So in a Family Justice Center, you're talking about public-private partnerships. So what does your public leadership or champion look like? This is Mayor Tom McNamara. I can't pronounce it right now. I probably need some more water. He's just amazing. But he also had an amazing judge who was instrumental in bringing partners together. So we've had judges who have led this. We have mayors. We had nonprofit leaders. We've had survivors who have brought up a discussion to lead this discussion and bring people together. So Casey Gwinn obviously was our leader and champion, because you need one person to start the conversation and to get all your friends together. In San Joaquin, it was Susanna Schultz, who did a great job in bringing people together. She was part of victim advocacy at the district attorney's office. Catherine Johnson, a nonprofit leader running a shelter program. Judge Adrian, he was the leader there to convene the meeting in Cleveland, Ohio. Something about a judge who calls a meeting is amazing. It's not like a subpoena, but it kind of feels like a subpoena when the judge says, hey, let's have a meeting to talk about access to justice. Let's have a meeting about what services can be provided. And as many of you might know, the story of Mary Claire Landry, another nonprofit leader who was running a shelter program through Catholic Charities in New Orleans. And in New Orleans, they had a disaster. They had Hurricane Katrina that brought their community together. And what I say to people when they ask this question, who should be that champion or leader, is who do you go to now that you trust, that has a history of putting programs together, that has a history of collaborating with others. And then after you identify that one lone nut, that one dreamer, that one champion, it's bringing together that planning committee. And that planning committee has looked like different things in different places. So in San Diego, we had the San Diego Domestic Violence Council, and we created a subcommittee called the Family Justice Center Committee. Eventually, a momentum grew, and then we had a strategic plan. And in our strategic plan of what we wanted for San Diego, we said we want one thing. And we committed ourselves as the Domestic Violence Council countywide that one thing was opening up the San Diego Family Justice Center. So it became something we all focused on as a priority. Fort Worth, Texas did something similar. They established an FJC committee within their Domestic Violence Council. In Cleveland, Ohio, they established a planning committee led by Judge Adrian, who then invited everyone to the table, identified all the key stakeholders, and they'll be called different things in different places. But ultimately what they're doing is starting the conversation, starting the discussion, and starting the vision planning. What is it that we want for our community going forward? 5 years from now, what does that look like? Who is really the best place to start it? Domestic violence councils traditionally have been a good place to start, but some communities don't have a domestic violence council that's active or mobilized or ready to take this on. So leadership can really start wherever it is. And then, of course, we recommend that you start conducting focus groups as quickly as possible. We ask you to start looking at where are the services, where are the programs, are they spread out? We ask you to walk through the steps of a survivor. How many places do you have to go? How many steps do you have to take? What is going on to start making that business case for support, helping other people understand what victims go through, that in normal situations, no one knows. No one knows how many phone calls they have to make to get the help that they need. No one knows how many shelters are available, or how many beds are available, or how many courts you have to go through. So all of that is really key. And then, of course, we say document your history. It's creating a CV in many ways of what your community has already done, and then challenging people to dream big and imagine what it could look like. So some of the communities, like this one in San Joaquin and Concord, they actually marked it out. How many places, how many miles, how many hours. North Carolina actually figured out how many pages a victim has to essentially write, whether getting a restraining order or forms they have to fill out in order to get the help that they need. And then the next big step is continue to recruit more people, to educate people about what you're trying to do, to invite people to come to your planning process, to make it transparent and invite as many people as you possibly can to get that buy-in, to start building relationships, making new friends. And I will say, going back to this point I made before, every step is important. Do not take any shortcuts, because the magic is the process of doing all these things together and coming up with a shared vision. And then a little bit more about the informational meeting, which I also thought was key. In the San Diego model, we ended up having a monthly informational meeting throughout the county, wherever anybody would make room for us and allow us to tell our story, to share our vision, to open it up for questions. And then if you are still going strong, plan, plan, plan. We usually break it up into two categories. One is we walk you through over the informational phone call of all the homework that you can do and all the steps that you can take. And then we start with a 2-day study tour where our team comes in. Sometimes it's a little bit longer depending on your community, but we're trying to get a better understanding of your community to try to give you some real meaningful and educated and intelligent advice. And then eventually we will come back for a strategic plan to develop your 5-year plan. And then after the strategic plan, then we continue to work with sites to have work plans in 30, 60, 90, 120 days to try to achieve your goal. In many ways, we work backwards. Just as I mentioned before, starting this process mobilizes the community, and some communities have been able to identify a piece of property right smack in the middle of it, because people are paying attention. They see what's happening when you're transparent and you have like a website and you're sharing information. You never know when somebody might say, I've got property to donate, or the county has done an inventory of all of the property that's available and dedicates a building, a piece of property that you can work on. And then when you have that strategic plan, you start to envision of what it could look like, identifying the location, identifying the governance structure, because sometimes the governance structure may change, and most of them, I think, quite frankly, do, where you might start off as a special project between a government-led family justice center like San Diego, then you create your own department, then it went to a police department-led family justice center, and now the San Diego Family Justice Center is led by the city attorney's office. Where it'll be 5 years from now, who knows? There's a lot of discussion about a city-county led initiative, and that could look like a joint powers authority that will have more buy-in and more long-term sustainability for our future family justice center. The next big question is money, which has already come up here. I would say doing your business case, your business report, and we have a lot of samples of that. Some people call it a feasibility study. Some people call it the business case. And many times all of those things will present itself in your grant, and it's looking about the funding, how this is worth the money and it's worth the time. We always felt that if we could save one victim's life, it was worth it all. And as I mentioned before, we were able to reduce our homicide rate by 90%. And Casey Gwynn's most recent study of that, he's figured out that per population, per homicide, San Diego today remains as one of the largest city, top 10 cities. I think we're the 8th largest city in America with one of the lowest domestic violence homicides in the nation. And as you can see from 30 years of work, it took 30 years of work to get there. So this is a project for the long haul. It's a project that is ultimately going to provide community for professionals and survivors. The other thing that we offer to those of you as we're kind of wrapping up, I got the 10-minute or 5-minute signal from Riley, is join us. Join us for our monthly calls with directors that have already started family justice centers, others who are in the development process. It's quite frankly a learning exchange that we do nationally. So we have very focused discussions. Our directors are involved. We identify a topic every month to really focus in. Sometimes we take chapters out of the Dream Big, Start Small. Sometimes we take issues that have been identified by directors. I'd say make good use of the resource library. Natalia, Riley, and Bryn have done a lot of hard work identifying really good resources, and Rayanne, as she's been helping us. She was the former operations manager from Alameda. We also had Michael Burke from Shasta, the former director there. Our amazing team, we keep looking for great samples for you to take a look at so you don't have to reinvent the wheel and get open sooner. All these things are available to you. And then ultimately too, there's a focus as we're going forward on trauma-informed services, hope-centered family justice centers. What does that look like as we go forward? We always like to tell the story of Lisbeth and Natalia, since you're featured in this photo. In fact, I'll take this one because it just means so much to me. Lisbeth was one of our survivors who came to the San Diego Family Justice Center, and Lisbeth is still in our lives today. She has been the chair of the Voices Committee in San Diego, and now she is a member of our National Voices Committee. And what you see here is Lisbeth as she is getting a microloan to start her business back in 2014. And she opened up her own business, opening up a cleaning service and actually providing services to the shelter that she once stayed at. Today, she's thriving as a smart businesswoman. She's working also full-time at the district attorney's office, helping other victims who are experiencing homelessness. Her kids have gone to Camp Hope. They are thriving. They're on their way to college. As you can see here, this is by Casey's, one of his favorite photographs with Lisbeth's son, as he's receiving his character award after attending Camp Hope. But if Casey were able to join us, and today he was not, he is in Idaho, waiting for his 4th grandchild to be born. So we're all very excited for the Gwynns, cheering for them. But as he would wrap up today, he would say our challenges are still to come. And as we continue to our work and think about family justice centers as we continue to grow, that we must really focus on the children and the adult survivors and creating that community. But we've also had a lot of great discussion lately to talk about offenders and aggressors, because we're not going to solve this problem simply by focusing on our survivors and children. We have to focus on the offenders as well, especially now since we have jail reform and bail reform and everybody's getting out of jail early. We're having that discussion as what does a family justice center look like for offenders? Because when they get out of jail and they have to address their alcohol issues, going to counseling, parenting classes, they too also need one place to go to receive all the services they need, not go through the runaround, and hopefully be more successful. So that's our challenge now, is how do we go forward considering all of these very complicated issues? How do we go forward creating a culture of hope, hope-centered? And I think when the Family Justice Center works well, it is that center of hope. It does create that culture of hope. And if you haven't heard about Casey's new book written with Dr. Chan Hellman and talking about the science of hope and how we can rise the hope scores for survivors who are robbed of hope given what they have experienced. Please take a look at this. I have now read it. I think I'm on, let's see, 5 times. Our whole team is reading chapter by chapter together. And I think just reading it together as part of like a journal club has really done a lot to raise our hope scores as we are measuring it, challenging ourselves. What does a hope-centered organization look like? And then, of course, we have our guiding principles that we did not get to talk about today, but you will see when you download this PowerPoint that there was a little section that we missed, which really talks about our guiding principles, our strategic directions, the people that have helped us think this through, and our top priorities as we move forward. So given the time, which is now exactly 11:30, and I want to honor your time, I guess it's just time to say goodbye. But thank you so much for joining us today. It was fun for me to kind of go through our history and also realize that we do have a lot more to do. So please join us for our next international annual conference, and that's going to be Living a Legacy of Hope. It will be right here in San Diego, May 19th to the 21st. We also have an upcoming webinar talking about ACEs, because ACEs and hope, it's all wrapped up together. So I'm excited that I think I'll be hosting this one with Jane Stevens, and we'll go deeper into ACEs. And then I just want to thank our team for putting this together, making it look easy and simple and just smooth. So thank you, Riley and Bryn and Natalia, for joining me with this call and putting everything together. And again, thank you all for joining us. Have a great day and hope to see you at one of our calls, webinars, or conference.